Wonderful. So to our many participants that are joining us, a warm welcome. It is lovely to see you all, and welcome to this UNICEF and Alive and Thrive webinar, the first in a series of 3 webinars that we will be hosting for the remainder of the year. And we are looking forward to having you participate. And as you will see, the topic of today's webinar is social and behavior change in East Asia, looking at the COVID adaptations and innovations that countries have made. So it's wonderful to see so many of you join us. Please feel free in the chat box to say your name and which country you're from. So we would welcome you. We've got a note. So Linma is saying that she cannot hear. And Linma, you should be joining us as a panelist. So you would have been, Linma, you would have been sent a separate email with your instructions to join as a panelist. Lovely to see everybody joining from all the countries. And hello, Kruan, lovely to see you joining us. And Josephina, lovely to see you. Anne, lovely. It's really Thelma. There's many colleagues. We have 118 colleagues that have joined so far, and that is lovely. And delighted to have you all with us. And if you'll just, we're going to give it a moment or two more before we begin the session formally, so that we can allow a few more of our colleagues from the region to join us. And it's lovely to see so many people from all around. And Jennifer, it's lovely to see you as well. So greetings, and also to our colleagues I see from Indonesia, Myanmar. Wonderful that we have so many colleagues from around. And in actual fact, what we're going to do now is we're going to put a poll on the screen so that you are able to share with us from which country you come. So I'm going to ask my colleague to put up the poll. There you go, everybody. So we ask you all to fill in. We know that not all the countries are listed there because we limited with the number of multiple choice options we have. So if you could all please just make sure you fill in which of the countries you're from. If your country is not listed there, then please put yourself in under other. Don't feel any less welcome though. You are all most welcome. And we will give it a few seconds for everyone who's online. We have more joining us to please fill in the poll. We'd love to see where we have our colleagues from on the call. So I will give it a few more seconds and then we will get going. So I think we've reached a magic number, and I'm sure there will be more colleagues that might join us. But let's see the results of the poll. So hopefully we're going to share the results of the poll on the screen. Great. So at the moment, Indonesia and Myanmar and the Philippines. Wonderful. Look at the Philippines. But all the countries are absolutely most welcome, and it's lovely to have you all with us. And we're going to really benefit from hearing from all of our country colleagues as well. So lovely. Thank you. You can close the poll for us. Thank you. Just some housekeeping notes as we begin. Please make sure, and I think everyone's done enough Zoom calls now in this COVID period to know to please keep yourself muted and to please also keep your camera off. That just helps us with the bandwidth for everybody who's listening. but our speakers will indeed put their cameras on when they are speaking, so you can feel more connected to them. And what we would then like to say is that you will see you also have the Q&A box. Please use the Q&A box only to put in any questions you might have when our speakers are talking. So we will use the chat box as you are to say hello, and it's wonderful to see our 7 participants from Vietnam all together, and our Central Java colleagues as well, so wonderful. The chat box will be for the purposes of that, and you will use the Q&A in order to put in any questions that you might have to our speakers. How our session is going to work today is after our introductions, we are going to have what we call a framework session, where we're going to have a speaker that will set the context for our workshop today. And then we're going to have 3 country colleagues from Myanmar, from the Philippines, and from China, who are going to share with us some of their experiences of SBCC counseling and professional support during the time of COVID. We will then have a panel discussion from them, and we'll go to some closing remarks. So with no further waiting, I'm going to hand over to someone who I don't think needs any introduction to everybody on this call, because I think everybody knows Roger Mattison from Alive and Thrive. And Roger, it's lovely to see you on the screen, and the floor is yours.
Thank you, Jane, and good afternoon, good evening, even good night for some of you, and good morning to Jane and others in that time zone. So I'm thrilled that we got this opportunity to organize the 5th biennial workshop amid the pandemic. And we have country teams, as you saw, from Cambodia, China, Indonesia, Laos, Malaysia, Mongolia, Myanmar, from Vietnam, the Philippines on the call today. And we also have colleagues joining the call from other countries and less convenient time zones. And many of you are working while at home. And many of you have also attended the previous workshops, and some of you are relatively new to this group. So let me start with a few words about Alive and Thrive. So we are a global nutrition initiative established with funding from Bill and Melinda Gates Foundation. And current donors include Irish Aid and Tanoto Foundation for Southeast Asia. Alive and Thrive is managed by FHI Solutions, which is a non-profit in the FHI 360 family of fit-for-purpose organizations. FHI Solutions also manage 2 other initiatives that are nutrition-focused, innovation-led, and that's Intake, the Center for Dietary Assessments, and from last week, 1000 Days also joined us. I would also like to use this opportunity to introduce Lisa Doherty from Irish Aid. She recently replaced Rekva Fitzgerald as the Deputy Head of Development for Irish Aid, and her colleagues and Lisa will manage the regional portfolio out of their embassy here in Hanoi. So Faulcha, welcome to the region, Lisa. We have been challenged to do things differently in 2020, and this biannual workshop, organized since 2013, is no exception. So to better fit the online format, we have portioned the program into 3 monthly webinars that concludes with a virtual consultation. And the agenda is also a bit different and focus on program adaptations during the pandemic. If you look at the objectives, so the specific objective of the webinar series is to provide technical updates, knowledge sharing, and innovations towards maintaining and scaling up evidence-based intervention for MIYCN in the context of the pandemic. And this first webinar is focused on social and behavior change communication. Yeah, so many of you remember that Jane Badham was the moderator for the workshop held in Thailand in 2016 with a strong focus on policy and advocacy, and in Vietnam in 2018 with a strong focus on health system strengthening throughout the continuum of care. So we are grateful to have Jen also facilitating this, this time for us. And in addition to being an energetic facilitator and a nutritionist, she has also become a very high-tech Zoom moderator. So we're very excited about that and looking forward to a very interactive and inspirational webinar. And it's now my pleasure to hand over to Roland Kupka, the new Regional Nutrition Advisor for UNICEF East Asia and the Pacific Office. So thank you for your attention.
Thank you very much, Roger. And hello, everybody from Bangkok. On behalf of UNICEF, I would like to welcome you to this webinar on social and behavior change in East Asia. As Roger said, I'm the new UNICEF Regional Nutrition Advisor based in the East Asia Pacific Regional Office in Bangkok. And I look forward to working very closely with all of you in the region. Let me start my remarks with some things. First, a big thanks to all of you for taking time out of your busy schedules and for joining us today. And thanks also for Jane for agreeing to facilitate this webinar. Secondly, I'd like to express my big thanks to our long-standing partner Alive and Thrive and also Irish Aid for the co-organization of this webinar. And thirdly, I would like to thank and acknowledge the leadership of my predecessor, Christina Granger, for her work on this partnership and for advancing the nutrition agenda in the region. I wish her all the best in her new role as UNICEF Regional Nutrition Advisor in Eastern and Southern Africa. For today's webinar, I'm really pleased to see so many participants. I see more than 150 participants are currently on the call because we're tackling a very important problem and for which I think we have not made sufficient progress. That is, in too many cases, when we talk about social and behavior change in health systems, this really remains an afterthought. And we also insufficiently use other platforms such as community platforms or media to promote recommended breastfeeding and complementary feeding practices. For us at UNICEF, this webinar is also very important and indeed very timely as we're about as an organization to launch our 2020-2030 Global Nutrition Strategy within the next few weeks. In the strategy, we recognize that the need for diets, services, and practices to protect, promote, and support good nutrition has never been greater. And in today's webinar, we will get to address all these three dimensions, and we will have a chance to go into some greater detail on how to influence individual practices and social norms affecting maternal and child nutrition. In the UNICEF Nutrition Strategy, we also propose to take a systems approach, that is to look at the food, water and sanitation, education, and social protection systems. Very importantly, that systems approach also includes the health system, and which is, of course, going to be the focus, again, of our discussions today and in the subsequent webinars. Now, as organizers, Alive and Thrive, Irish Aid, and UNICEF, we do hope that you will get to join also the upcoming webinars in November and December, and then the January workshop, which will allow us to bring together the different elements discussed in the webinars to create MIYCN-friendly health systems in Southeast Asia and beyond. So for today, I wish us all an informative first webinar. And with that, I'd like to turn it back to our moderator, Jane.
So thank you very much, Roland. And before that, Roger, it really is wonderful to be with you again, even though it is virtually. And as you said, it's a really important topic because often social behavior change communication does get a small part of the noise and the talk. But that's why we focused this whole session on it, because it is so important. And as you said, Roland, never more important than right now in the context of COVID-19 and making sure that we are still heard. So our first presenter is based in Washington and therefore cannot be with us personally. And so our first presentation is a pre-recorded presentation. And our speaker is Christina Granger, who is from Alive and Thrive, where she is their social behavior change communication advisor. Christina has many years of experience working in many contexts. So it is our pleasure to have Christina join us remotely. Please remember that she's not with us in person, but please, if you have any questions, you're welcome to put them in the chat box. We'll see if others of our team can answer them. So thank you, and let's hear what Christina has to say to us.
Good afternoon, ladies and gentlemen. I'm excited to be able to have the opportunity to speak with you all this afternoon. I'm based remotely in Washington, D.C., and so I'm sorry that I'm not there to be there in person, but I look forward to other opportunities to engage with each of you in the future. So today I'm going to get started by talking about social and behavior change communication, and specifically looking at counseling, professional support, and media. So let's get started with some definitions. What is social and behavior change? Social and behavior change is a systematic, evidence-driven process to improve and sustain changes in norms, behaviors, and the enabling environment. Social and behavior change communication is specifically referring to the role of communications in bringing about this change. So let's look at the C in SBCC. What do we know about the role of communications for behavior change? Well, we know quite a lot. We know that communications is not enough, we know that knowledge is not enough to change behavior. Neither is communications alone, in fact. We also know that behaviors are heavily influenced by our context and the reality in which we live in. So that being said, effective communications will account for and be designed for the enabling environment and context in which people live. Communications never stands alone, and we want to be sure that materials and communications approaches should always be part of a larger SBC strategy with acknowledgement of the broader system in which they're being used. So let's talk about what we can do to use SBCC to achieve MIYCN impact. It's critical that first we're following a SBCC process in designing and planning our activities. Counseling, support, and communications must fit within a larger strategic plan that should be designed with the context in mind and should be designed with a process such as this. This isn't the only process. This is one that Alive and Thrive has used in some of our programs, but there's many other similar complementary processes that exist, which all have about the same steps, just worded in slightly different ways. So you want to make sure that using these steps, you can ensure that your activities will fit within the context and help you achieve your MIYCN outcomes. So let's move on to this concept of counseling and support. What do we know about effective counseling? Well, we know that IPC, interpersonal communication, is the approach most consistently used and effectively used and has the most published literature to support it. So IPC is a critical component to achieve behavior change. We also know that counseling is a skill. Anyone can't just pick up a job aid and effectively counsel someone to improve breastfeeding practices or complementary feeding. People must be trained and have explicit expertise in counseling in order to be effective. And supportive supervision is key. Monitoring data should inform supportive supervision, and it should be used to motivate staff to identify skills gaps and also to provide targets. So digital media as well is another SBCC approach that has been proven effective for social and behavior change. Media can include mass media, community media, and social media, among other types. Media is also used in connection with IPC and other approaches to increase behavior change and to help spur norm change, and also social change. A critical aspect of media is to ensure that you're creating high quality and professional looking materials. And the way to do this is to engage with creative agencies to ensure that your work is professional and high quality, and also to never skip on the pre-testing and concept testing steps. These are really important to ensure that what you're developing resonates with your intended audience. So another aspect of digital media is social media. And social media is increasingly used in SBCC programming. And one benefit of it is that you can facilitate a two-way conversation. It's not just where mass media typically sends out information via television or radio, but you're facilitating a virtual dialogue in order to help spur change. So some tactics that we use in social media are to leverage influencers and create champions for change. So you'll see the example on the left here is from a breastfeeding campaign in Myanmar, where a social media influencer was used to showcase themselves as a champion for breastfeeding. So I wanted to dig in a little bit into the data and some lessons that I've learned that have come out of the Alive and Thrive experience, and also informed by global best practices as well. So this data on this slide shows that reinforcing messages through multiple contact points and frequency of contacts has a huge influence on effectiveness of behavior change. So in the first graph, you can see that the higher uptake of certain practices was by percentage of recommended visits to the health center. So the more contact opportunities increased the behavior change that we saw. The second graph shows that young children who consumed an egg based on their caregiver's exposure to intervention activities was higher given the number of activities that the caregiver was exposed to. So exposure to more activities and the higher level numbers of contacts leads to greater behavior change. From another graph we have here, we can see that combining IPC, mass media, and community mobilization led to higher levels of behavior change as well. So some best practices to consider are ensuring that you have effective coordination of messages across your different contact points and communication channels. Now, this doesn't necessarily mean that you want to repeat the same messages across all of your channels, but that you are coordinating your messages so that they could be focused on different behaviors and different audiences, but ensuring that they're complementary and consistent across each of your different channels. You also want to understand which channels are trusted and most used by your different audiences. So in this way, you can tailor your approaches to your context more specifically. So despite this current evidence and best practices that we just discussed, there's a distinct need to adapt what we know and do into the new reality of COVID-19 context. So we know that practitioners must find new ways of working, which include physical distancing and engaging with families in new ways. And so we must adapt our approaches, and our recommendations must now more than ever be feasible and doable for our target audiences. According to the latest estimates from The Lancet, an additional 6.7 million children will be wasted in 2020 due to COVID-19's impacts. It's widely recognized that MIYCN and nutrition services focused on the first 1,000 days are critical and should continue globally, even in this context, by any means possible. So there's a number of considerations that we need to take into account. There continue to be disruptions in services. Some cadres may not be able to access the communities in which they serve. We'll have reduced hours, reduced facility access in some cases. We also have communities who may be reluctant to visit facilities given their fear of risk or infection. There's increases of toxic stress and depression and other mental health concerns given this context, which can actually lead to a low uptake of MIYCN behaviors and issues with feeding. And we also have our families are experiencing loss of livelihoods in many cases, which can affect their ability to purchase healthy food. And then information overload, which can lead to confusion, misinformation, and rumors. So with these things in mind, with these challenges, there are some specific considerations that we want to take into account for our SBCC approaches and programming. So the first one is that we really need to ensure that we are adapting to virtual support and training. So there's a shift to be offering these services through non-contact means instead of face-to-face or in addition to face-to-face interaction. And so the key thing here is that we need to ensure that we are training these nutrition service staff in order to respond in this new context. One of the examples of how training can be done virtually is the COVID-19 Digital Classroom, which is a collaboration between the Community Health Academy at Last Mile Health, Core Group, Medical Aid Films, and Tech Change. You can see the URL on the slide right now if you want to access it. And they provide virtual training for community health workers on COVID considerations and other health service considerations in this new context. Another thing to consider is the change in service hours and social protection schemes and other services should all be reflected in counseling. We need to ensure that the messages that are given to the communities are reflective of the reality that they're currently living in. And additionally, we want to ensure that MIYCN content is reflective of the COVID-19 context. There are considerations for feeding if you suspect infection, and there are considerations for health services if you suspect infection as well. And so one of the resources that is now available is based on the UNICEF CIYCF counseling package. There's a new supplement that is infant and young child feeding recommendations when COVID-19 is suspected or confirmed. And so this set contains 10 supplementary counseling cards as well as key practices booklet for health service workers to use. And it's currently been translated in, I believe, 10 different languages and used in 20 or so different countries. And some of your countries might already be using it as well. So there's also considerations for communications broadly to first and foremost reduce information overload. When people are concerned about a perceived threat, we know that their ability to process information effectively can become severely impaired, which means clear and precise information is essential. Less is really more. We also want to be sure that we're using remote communication channels to continue our promotional efforts with non-contact methods. Another consideration is to use two-way communication whenever possible to facilitate a dialogue. Consider participatory radio programming, social media support through virtual communities, or conversations by phone or text. Even with limited in-person access, materials and messages must still be pre-tested. This isn't a step that can be missed. So consider using virtual channels to pre-test messages. There's manuals and guidelines available online in order to help you do this. There's some digital media considerations to take into account as well. The first is that we want to increase promotion and modify content of existing health hotlines and other digital services. One consideration here is also for virtual training. We need to ensure that hotline counselors and staff are also trained to make referrals and to access resources and social protection services in this new context as well. Considering all the technologies and media that the intended audiences are already using, we want to ensure that we are leveraging what exists as trusted resources already. Now may not be the time to test new apps or to develop new social media groups to engage with. It's important to really meet people where they are instead of trying something new at this point. There are some considerations too for handling misinformation, which we know is a big issue in this pandemic. Many people have called it an infodemic because of all of the rumors and information that have been going around globally. One suggestion is that you can establish a repository that collects rumors and misinformation, and then authorities and change agents can have these in one place to be able to figure out how to best and most effectively address them. Some of the evidence actually shows that addressing misinformation can sometimes be counterproductive if you're promoting the misinformation in the way that you talk about it. So it's important to make sure that you're focusing on facts rather than further promoting the myths or misinformation. So this concept of virtual support and communities has been a growing trend for at least a decade now, but certainly with this new context of COVID-19 pushing everyone into a virtual world and reduced contact, we know that this will spur the use of digital activities in our world even further and faster. So I wanted to take a quick look at what's trending in SBCC currently, and especially in the given context. So in this current reality, global reliance on virtual support and communities is ever increasing. Smartphone usage has grown exponentially, and most of our audience are already using digital media multiple times a day. So we must adapt to how people are currently seeking and building, seeking information and building relationships. Research has actually shown us that many of our MIYCN behaviors require a supportive context. And in the past, we always considered a mother's household environment or community her supportive context. But increasingly, this could also refer to her social networks and peers. And so, for example, research from high-income countries has shown that social media groups can, in fact, positively influence breastfeeding behaviors and attitudes, as well as lead to longer duration of breastfeeding. So this is an area that we're using more and more in our approaches, and there's more research devoted to it as well. Another thing that we need to be doing more of in our work is this idea of tailored and personalized messages. And I don't mean one-on-one personalized messages, but rather when we're looking at the digital media environment. Breast milk substitute manufacturers, excuse me, have been using this trick for quite some time by using the vast amounts of digital data that is out there on the internet. And we in public health need to do quite a bit more to leverage the same data and really personalize our approaches and our messages to our audiences to meet them where they are in this ever-increasing digital world. So those are a few of the trends in SBCC broadly and where we see its relevance, especially in the current context of COVID-19. So given this overview, I think it'll be so interesting to now hear from our colleagues from a few of our different countries to hear some specific examples of adaptations and considerations for SBCC approaches from their work. Thank you so much for your attention today. I'm sorry again that I'm not there in person, but I am confident that my colleagues will be there to answer any questions that you have. Thank you.
So a very big thank you to Christina, and we're also sorry she couldn't be with us in person, but I think her presentation really sets the scene beautifully. And it really is about saying the kind of counseling we're talking about here is indeed a skill. You need to be trained and you need to have explicit expertise. I also liked her point that the number of contacts is really important, and that we have to also learn to tailor our messaging and the way we do it to the types of contacts that we have. I think my overwhelming takeaway message from Christina at this time is the saying that the art of life is a constant readjustment to our surroundings. And boy, in 2020, have we all had to make constant readaptations to how we live, work, play, and connect with people. And that is really important for us to continue doing that in the context of IYCF. And so we've asked 3 of our country colleagues to present to us some of the work that they're doing. So while my colleague gets up the first slide for our first country presentation, it is my complete pleasure and great pleasure to welcome our colleague and to a friend, Dr. Nguyen Ma, who's the acting director of the National Nutrition Center within the Ministry of Health and Sports in Myanmar. And Dr. Nguyen Ma is going to talk to us, as you can see, on protecting, promoting, and supporting IYCF through behavior change and sharing with us the experience of Myanmar. So Dr. Nguyen Ma, it's lovely to see you on the screen. Please unmute yourself and I will let you know. So keep an eye on my screen. I'll let you know when you have 2 minutes left. So welcome and over to you.
Thank you, Jane, for the introduction. So as Jean already briefly introduced, that I will share with you.
Dr. I'm just going to interrupt you and ask if you can just speak a little bit louder, please.
Okay. Is it better now?
It's a little bit better. Just keep trying to speak your very loudest. Thank you.
Okay. So as Jane already introduced, that I will share with you how we come up with to protect, promote, and support IYCF through behavior change. So next slide, please. So in Myanmar, we have, before the COVID-19 has came into as the pandemic in the world, in Myanmar, we have tried to promote, support, and prevent the optimal infant and young child feeding counseling through community-based infant and young child feeding counseling. We call it CIYCF. We train our basic health professionals, volunteers, and the implementing partners through the IYCF counseling starting from 2018. And it, as we all know, the three main components for promotion of maternal nutrition and promotion of optimal breastfeeding and complementary feeding practices. Next, please. And then in end of March this year, we found the first case of COVID-19 confirmed case in Myanmar, and after yesterday, we have 20,033 confirmed cases with 470 death cases. So next, please. So during this COVID-19 situation, as similar to other countries, that we are also facing now the second wave of COVID-19. In this situation, a lot more focus are on prevention and the containment of the pandemic, while we shouldn't forget the importance of maintaining optimal nutritional status of our community. So maintaining our essential nutrition services during the context of COVID-19, it needs a lot more linkages among the essential components, like we need to adopt the standardized guideline, capacity building of our implementers, and we have to ensure that the supplies and equipment are in a sustainable manner to supply throughout, and coordination and technical support and integration of nutrition into risk communication and community engagement strategy, and technology for nutrition and nutrition support in the quarantine site, and multi-sectoral linkages, and of course, we shouldn't forget about the evidence generation. So next, please. Out of those linkages, in this section, I will just focus on a few points. The first is in Myanmar, we already have the nutrition and emergency programming guidance after we have encountered the cyclone Nargis in 2008. So we have already had the nutrition and emergency guidance, but in this COVID-19 era, we have adapted that NIE guideline during the context of COVID-19, as Christine has also shared in her presentation, that we developed the guidelines and SOP for the context with partial or full population movement restriction. In that guideline, we have included 13 annexes, including the community infant and young child feeding counseling, integrated management of acute malnutrition, and also multiple micronutrient supplementation. We also have developed, as shown in the right upper corner picture, we developed the IYCF counseling card, while also emphasizing the COVID-19 preventive measure, risk mitigation, risk prevention measure as well. And we have also conducted the virtual training on IMM for our implementing partners and ethnic health organizations. In May, during May, we have conducted 2 virtual training for our partner organization with more than 300 participants throughout the country. And for the government side, we have conducted the CIYCF training for state or region nutrition teams in August, in which more than 100 of our state or region nutrition team members joined with us, how we can continue with our essential IYCF services in the context of COVID-19 while following the physical distancing measures and also the risk COVID-19 spread preventive measure. And the counseling practices continue, of course, with very limited situation, but as following the preventive measure and as per the guideline. Next, please. Next slide, please. Hello, next slide, please. So this is just to share with you some of the examples that we have developed with the, sorry, previous slide, please. Yes, thank you. This slide, we showed that to share the Ministry of Health with the support from the UNICEF and some of our partners organization, UN organization, we provide the animation GIF picture to show the community not to forget the importance of infant and young child feeding practices, while also highlighting the messages about the prevention of COVID-19. Next slide, please. This is the same as well. Next, please. So with that, I would like to, no, I think two more back, two more slide back, one slide back, I think. Next slide, please. Yeah. So we also integrate the nutrition into risk communication and community engagement strategy to highlight our community that while people are afraid and scared of this getting infection, but not to forget the importance of maintaining optimal nutritional status, which is of course the essential component to boost the people present community to get infected, as well as even if the person is get infected, then he or she can recover better than the one who is malnourished. So for that, we integrate the nutrition into our RCCE strategy. And in Myanmar, we also have multi-sectoral national plan of action on nutrition, in which considering the multi-dimensional nature of underlying causes of malnutrition, we include all the relevant sectors like social protection, education, agriculture. So during this COVID-19 situation as well, COVID-19 response activities, we need the multi-sectoral response activities. So there were a lot multiple partners and sectors are included, including the UNICEF and our partner organization provide the technical and capacity support to implement the nutrition intervention while considering focusing the COVID-19 risk reduction and mitigation measures. While the social protection sector also provided top-up cash transfer for maternal and child cash transfer program, we from the health sector also to ensure that we provide a multiple micronutrient supplementation for the MCCD beneficiary, the pregnant women, by providing the multiple micronutrient supplements. And also for the farmers, we also provide the seed to ensure that home gardening activities not to mitigate or minimize the impact of COVID-19 on food security and nutrition. Next slide, please. Next, please. Next. So with that, from this section, I may extract three key messages. That first, we are using the existing coordination platform from our multi-sectoral nutrition effort. We realized that the strong collaboration among sectors and partners in the context of COVID-19 while maintaining the optimal nutrition behavior among the community, and also integrate the nutrition into risk communication and community engagement strategy, which come up with the more visibility and reprogramming for maintaining essential nutrition intervention. And integration of nutrition into technology for development platform for COVID-19 is more effective with the virtual forms. We need to, nobody knows that how the situation will come settle down. So we have to continue with our virtual world to continue our essential services by providing the capacity building of our health workers, our partners, to continue to provide essential nutrition services to promote optimal nutrition behavior in the community. So with that, I would like to end up my presentation, and thank you so much for your kind attention.
Thank you very much. Thank you, Dr. Rinma. Apologies, I know that the sound was not very clear, but this is a time to remind you that you will be able to receive the slides where we think you will be able to have seen, and I think we really did get the core messages as you've shared here on the final slide with us, Dr. Rinma. And your presentation also makes me think of another saying that says, intelligence is the ability to adapt to change. And right now, all of you as our country counterparts are really having to make those adaptations, and you are showing incredible intelligence and creativity in doing so. So we want to salute all of you and thank you for the work you're doing to make sure that at this difficult time, with lots of misinformation that abounds, that we continue to protect, promote, and support breastfeeding. So we're going to take a trip now from Myanmar and head to the Philippines. And it's my pleasure to introduce our next speaker. And Jovita Ravel is the Division Chief of Nutrition Information and Education Division at the National Nutrition Council in the Philippines. And Jovita is really going to show us how they have worked to go on to the online counseling. And I think that's going to be really interesting, Jovita. So welcome, and the floor is yours.
Thank you, Jane. Good afternoon, everyone. Allow me to share the Philippine experience in conducting online counseling on infant and young child feeding done by their breastfeeding friends or BFFs, initiated by the National Nutrition Council, National Capital Region. Next slide, please. Although IYCF counseling is being done as part of the regular activities, it was during the lockdown in Metro Manila that the online IYCF counseling was conceptualized. Actually, it started on April 7. It must be noted that there are existing online groups that provide support on breastfeeding, but these are all very informal. With the lockdown, there were many calls for formula milk donations, but since the Philippines strictly enforces the milk code, the NNC identified a way to support mothers so that they can, of course, continue breastfeeding and not have to rely on formula milk while there is lockdown and while observing minimum health standards such as social distancing. Initial talks were done with the Association of Nutrition Program Coordinators, whose members were already trained on IYCF so that they can take on the project. Its members agreed to do the online counseling. The existing Facebook page of the NCR, was used to announce the service, calling on pregnant women and mothers to talk about their IYCF concerns. Mothers were asked to send their details such as their name, their age, contact number, their area of residence, if they are pregnant or breastfeeding, and any other problem or concern on IYCF. Next slide, please. The NNCR devised the process for the online counseling. Note that up to now, there are no formal guidelines since the project is still a work in progress. Queries received from private message in NNC's Facebook page are referred to the BFF's Facebook Messenger group chat, in which a member volunteers to take on the mother to be counseled. The IYCF counselor of the local government unit where the mother resides is the one who usually volunteers to counsel the mother. Details of the inquiry and the contact information are sent through a private message to the volunteer counselor, and they will be advised to contact the mother or the caregiver via SMS, call, or Viber. A Google Sheet tracker is prepared so that information on the mother is encoded. The same form is used by the counselor after counseling to encode results of the counseling, of course. The Google Sheet tracker is updated and is monitored by the National Nutrition Council, and referral is made if there is need for follow-up. Next slide, please. Here are examples of the Google Sheet tracker used to record the counseling sessions. It specifies the particular problem encountered by the mother and the action done by the counselor. So this is continued until there is some resolution to the problem. Next slide, please. To keep the project going, the NNC convenes online meetings among the BFFs for updates and discussions of case management. In cases when there's a need for home visit, the community nutrition volunteers in the village are mobilized to visit and provide additional counseling. For cases needing medical advice, they are referred to any of the two volunteer doctors who are also IYCF advocates. The BFF also has access to online resources on IYCF via Google Drive prepared by NNC. NNC takes care of the follow-ups and administrative work, but eventually this will be turned over to the association. To evaluate the quality of the counseling, mothers provided with the counseling are asked to fill up a simple evaluation form composed of 3 questions related to the quality of the counseling received. Note that these components were not planned from the start, but is actually evolving as the project is being implemented. Next slide, please. The project has met some challenges. Because it is online, some queries would be sent late at night since that is the time when mothers had free time from work or chores. Messages were responded to the next day and or referred to counselors willing to counsel beyond office hours. Note that counselors were also busy with COVID-19 response. Some mothers did not have regular internet, so they were counseled using SMS or text messages. The NNC monitors the Google Tracker, and sometimes the counselors do not update the Google Tracker, but the NNC reminds them to do so. There are problems that are difficult to resolve online, such as inverted nipple or poor milk flow. So these are referred for home visit. In one case, a video on lactation massage was shared. After 5 months of implementation, the project was able to respond to queries for counseling and received excellent rating from clients. NNC prepared social media cards and posted them on the Facebook as testimonials of the mothers who were counseled. The project has also inspired other local governments in Metro Manila to have similar projects. We will also share this experience to other local government units tomorrow in our National Conference of Nutrition Action Officers. Next slide, please. In summary, based on the initial feedback, the online counseling on IYCF provides a relatively inexpensive and accessible alternative to face-to-face counseling during the pandemic. The success factors include the existence of trained IYCF counselors who are willing to undertake the project, the availability of on-ground community workers for additional support, but they should also be trained, and the online project administrator, all of whom should have the innate desire to help others. The development of a simple online mechanism for generating mothers to be counseled, providing follow-up and feedback, and having regular exchanges are key to the success of the project. The project is a work in progress, and there are plans of further improving its management. Thank you very much, and good afternoon. Back to you, Jane.
Thank you, Javita. What an exciting project to hear about. And it really says to me, if we fail to adapt, we fail to move forward, and we fail to protect optimal infant and young child feeding. So the fact that you're adapting as you move and you keep moving forward and keep adapting is really the way we have to go at this time. So Javita, thank you very much for sharing that Philippine experience. I think we've all learned a lot, and I'm sure we're going to have lots of inquiries about how people can follow what you've done. So thank you very much. And so now we'll take another flight, and we're going to move now from the Philippines up to China. And it's my pleasure to welcome our UNICEF colleague from our China office, Anu Narayan, who is the Chief of Health and Nutrition of UNICEF China. And Anu is going to share with us how they've explored the role and made use of social media during this time. And I know we're all interested to hear what you have to say. So Anu, the floor is yours.
Thank you, Jane. Thank you for the opportunity for us to present what we did during COVID in China. I obviously want to start by acknowledging that this is work of a team. I'm just representing the work that has been done with the support of members from my team here in government, but also from our regional colleagues who really helped to sort of pull things together. I also think it's a great opportunity to sort of build on the last two presentations, because ours is a little bit different in that it doesn't focus necessarily on infant and young child feeding. I'm going to give you an example of what we did with sort of older children, particularly adolescents. And also that obviously China, where COVID started, we were in very early days. So a lot of when we started the work, we didn't have the experience or the information that many countries currently have in terms of how COVID, the various aspects of COVID, including the likely impact. Especially, I think we were learning only later on how critical the role of nutrition was, particularly around COVID. So we had a lot of information gaps as we were pulling things together. So can we go to the first slide, please? So much of this data that I'm going to show here is from in mid-February. China had already at that time, mid to late February, where already most of the country had been in lockdown. And this is some of the information that was gathered through multiple smallish surveys. They're not very large surveys, but I want to sort of refer to a couple of points here. One is that most people spoke about how their diets had been impacted, particularly the children's diet being impacted. And they talked specifically about how they had to change the frequency of food that was being purchased, and that had declined. Obviously, incomes had declined, which was affecting the consumption of things like meat and fish consumption. And the fact that they were constantly looking to all sorts of, particularly social media sites for additional information. And if you look onto your right-hand side and to the graph that you presented, we did see that significantly large number of people, over 40–50% of people, said that they were watching much more of long videos, short videos. And as we have now seen from around the world, just being online or watching or using multiple sources of social media, the usage was just skyrocketing, and you're seeing some of the graphs there. And also proportionately, things like working out or spending time for other things that might lead to more physical activity, obviously that had become very much more constrained. We also spent some time identifying some of the specific aspects with youth. And there we saw that a survey that was done through the China Youth League, I think, was found that 45% reported that they were doing hardly any exercise. And then they felt that significant proportion felt that they had actually gained weight. So what we did was actually start the process by taking into account the fact that there was no programming actually being done, particularly for young people, adolescents and young people in particular. And so we came at it not so much from a nutrition angle. Initially, it was from an adolescent mental health angle. But obviously, that provides an excellent platform to also discuss specific aspects related to nutrition, as you will just see. So can we go to the next slide, please? This seems like a very linear slide, but to be clear, it wasn't so linear. In the sense that we were trying to, like most of my other colleagues and countries have presented, it was all a lot of adaptation and responding to needs as they came along. So initially, I think we focused a lot on video and short articles that were specifically focused on infant and young child feeding. I think there were no global guidelines at that point. We heard the mothers were being separated from their infants and babies. So a significant proportion of time went into that aspect of creating basic information around infant and young child feeding. Then we actually moved on to sort of this youth challenge, which I will describe a little bit more, and then followed up with additional things that we did about celebrating Breastfeeding Week or the online conference. All that sort of came along. But ultimately, we were able to actually have a pretty sort of comprehensive programming overall that met the needs across the different life cycle. Can I get to the next slide, please? So I'm going to spend a minute talking about, because we do so much social behavior change around infant and young child feeding and the importance on that for the nutrition community, let me take just a minute to sort of focus on that aspect. And I'm going to, I want to talk specifically about the first thing that you're looking at here. If you could just click the slide again, please. Yes. So this was a sort of a live streaming event that we ended up doing with TikTok, which is called Douyin, with our partners, which is the China Nutrition Society. And so the first time we had ever done anything like it. But what it ended up helping us is actually having a very, very targeted a group of people that we were able to reach. All of the participants were actually young parents and who had already been identified and there's a pre-set of a group that was already members through the public account of TikTok that the China Nutrition Society had, and using them as a partner and doing a live stream through them actually allowed us to have a very targeted approach. And we ended up having over 100,000 people at different times. I mean, on average, there was 70,000, but to reach a group like 100,000 people in an hour was sort of something we had never conceived before. And it was a really interactive session where people who were starved for information and could not actually access other things that they would have typically gone to because of the lockdown and shutdown were able to then use our expertise, UNICEF expertise, to sort of directly reach out to us. And the questions were like, as you might expect. I mean, questions were things like what type of fruit to eat? What happens if your child is not feeding properly? Can you sort of, what do you do if there's constipation? You know, things like that the people might not have had would have used, maybe call their healthcare facility or something. They couldn't now. They had to turn to a live streaming. And I think this is something we will continue to do into the future. Can I get to the next slide, please? And then the big part of what we did, which I do want to focus a few minutes on, is our work on the.
I'm going to just hold you to time, so you have 2 minutes left.
Okay, thank you. We did focus on youth, and here I think the partnership was particularly with a private social media company for the very first time called Kuaishou. It was something that we really leaned into because of the kind of company they were, which had a very high access to the young people in rural areas. And what we ended up doing is a combination of a live stream. Can you click again, please? A combination of live streaming as well as an augmented reality-based filter, which then allowed people to post different things by themselves in terms of, you know, when they participated. So there we had reached about over 11 million people were reached, including some interaction that we were able to get. So can we go to the next slide? And maybe just to say that the type of partnership that we ended up picking up, which is sort of, you know, the China Youth League, which was sort of giving us an overarching umbrella that we were doing for the adolescent mental health programming, the Kuaishou, which I just talked about, which was a private sector partner, which gave us sort of access to the adolescents and the types of interactive communication we were able to do, and the content that UNICEF provided. I think this was really interesting, with an ability actually to monitor in some ways, you know, what was the, how did people feel in terms of participation and engagement, particularly by the young folks. So I think the last slide of mine is really to sort of, you know, say that, you know, while yes, typically one doesn't want to start new things in the middle of a pandemic of this kind. On the other hand, it gives us many new opportunities, and we must learn to adapt and live with it. And I think for China, we had to plan at scale. I mean, really, there was no other way to do it. I really appreciated what some of the other colleagues had said before, is really understand your audience and where they are at and meet them through the channels and the way they engage. So the use of a thing like Kuaishou was deliberate, because that's where adolescents were engaged and were participating. The use of TikTok was deliberate, because that's where we could find parents, you know. And the use of data, I think, again, I think using private sector companies more effectively to use them to get data and analytics. I think we have to do a lot more of that. We shouldn't, not that we need to sort of figure it all out by ourselves. And then the last thing I'll say is the Kuaishou partnership has now resulted in a lot many more things that we are doing as UNICEF. We have engaged them now for the back to school campaign. We might use them in sort of the World Children's Day. So, you know, this can continue to evolve. And I am sorry if I ran over my time, but I'll take any questions. Thank you. That's it from our end.
Thank you so much, Anu, for again really great insights, and exactly why we put China at the end of showing how you've got to look for those opportunities more than ever in this time. We've got to be opportunistic. We've got to find linkages with perhaps uncommon, unusual partners, and we've got to really think about it. And it made me think of a saying of Richard Branson. He said, every success story is a tale of constant adaptation, revision, and change. And that is so much what you have also highlighted for us. So thank you. We're going to go into our question time now. And a very big thank you to all our presenters who have been working away in the chat box, in the Q&A box, while we've had questions being put up. So many questions have already been answered, but we might talk about them. So if I can ask my presenters to put their cameras on. We are also inviting Paul Zambrano, who is from the Alive and Thrive team in the Philippines, to join us. And we're also asking Chow Win Sen from our UNICEF office in Myanmar to also put his camera on, so that we can have all of you up with us for the Q&A. I'm going to start with a question to you, Anu, as you just presented. One of the questions we've had is, are there examples of effective tools to monitor changes in behavior or program delivery that is specifically suited for social media? Or are we just looking at the number of likes or the number of shares? Anu, can you give us a little advice around perhaps tools that really monitor behavior change?
Yeah, I think, thank you, Jane. I mean, this is something we really struggled with as well as we were pulling things together. I think I don't know that we have I don't have a perfect answer for it, for sure. But what we did learn, I think, is taking the question to the company in the beginning, because I think we are so focused on the ways that we actually monitor things that we often just even asking the company, in this case Kuaishou, what are the ways in which they could sort of use their platform to effectively gather more information, monitor engagement, monitor likelihood of continued, in this instance, continued sort of physical, continuing physical activity at home. That gave us some ways in which, they were able to build into the program ways in which participants could actually respond to some key questions. So not just a sort of a survey tool that we might just be thinking about, but ways in which that they could integrate stuff. And I think that is something we need to do more of, learn more of, and sort of more quick and easy ways of continuing to sort of monitor information like that.
Great, thank you, Anu. This question has come up a number of times in different formats in the chat box. So I'm going to open it to all our speakers. It's really this issue of, as we move more to the online, there's lots of questions around the challenges of connectivity, that for many it's difficult. Javita, and also reaching out into rural areas. I know, Javita, you mentioned that you would use SMS if people didn't have connectivity. But I'll start with you, Javita. Do you want to give any more, because yours really also was trying to do one-on-one counseling without really face-to-face counseling. So some advice around those challenges of not being face-to-face and limited internet. And then after that, I'll come to you, Dr. Nguyen to see if you want to add. Javita?
Yes, Jane, thank you for the question. If usually through Facebook, you can have your chats, but if there's no internet connectivity, what the experience was, they tried to exhaust all other forms of communication. You use SMS, and eventually, if those do not work, it's mobilizing the existing community workers, but of course they have to maintain the social distancing. That was the experience. So and there are also ways to connect, like now. We just have to find a way, like looking for a better place. And then sometimes the mothers don't have any money for the load, and in some instances, um, that's one type of support that can be given to them.
Great, thank you. Nguyen Ma, I know you've answered it a little bit in one of the in the Q&A, but let's hear a little bit on how you, even if they weren't always ideal, how you made some adaptations to reach those hard to reach people.
Thank you, Jane.
Nguyen, we can't hear you at all, so you're going to have to speak really loud.
Yes. For some areas.
No, so again, we can't, unfortunately, we can't hear you.
How about now?
Much better now.
So even though it's not ideal, we also even before.
Unfortunately, no, Dr. Lima, it's not working. So I wonder, Cha, do you have anything you want to add about the hard to reach? Because you're also from Myanmar, maybe your reception
is it okay now?
Yeah, it's okay.
I can hear you now. Try once
Yes,
more.
even though it is not ideal, but even before the COVID era, we do have the areas like we have no internet connectivity or no phone line connectivity. So with the help and support from our partners, we usually use the ways like very traditional method, like loudspeaker and handheld speaker providing the nutrition messages. This is one thing. And another thing is that we are discussing with UNICEF and some of our colleagues to establish the call center for IYCF counseling. But of course, this method will be challenging for us with no telephone line connection. But we do believe that for those areas with telephone line connection, we still can reach more on the individual one-to-one counseling, and the respondent can share their challenges and experience more frankly because it is one-to-one. So just to share with how we are working on and trying. Thank you. Over to you, Jane.
Thank you. Ko, do you want to add anything, Cho? You can unmute yourself.
Yeah, for the very hard to reach area, and the sun area recently fully population movement restriction area, especially in the camp area. We have our implementing partners. They cannot do for the face-to-face training counseling for this area. Now they are using only the mobile phone. But for the internet connectivity for this area is very hard, and they use a mobile phone for the counseling, giving the information, correct messages to the beneficiary also. This initiative between the lookers, implementing partners, and also involved in the sub-national level MOHS staff also. They are discussing, they initiate this one to the hard to reach area. Over.
Thank you so much. And Javita also added in the chat box that they've also made use of community radio that's also a really powerful tool that can reach many. And I think we also have someone who was saying that we really need to explore TikTok really well. The Indonesian Breastfeeding Mothers Association has a counselor who regularly posts a TikTok video on IYCF topics and has quite a big followers. So that's something else that we might all want to explore. This next question, I'm going to start back with you again, Javita, and then I'm coming to you, Dr. Lin-Ma. The question from our participant is, can you elaborate a little bit more regarding the IYCF counselor training that also had to be conducted virtually? And they ask whether you felt it gave the same result as face-to-face training that one was able to do before the pandemic. What sort of adjustments had to be made? So Javita, you first, and then I'll come to you, Dr. Lin-Ma. Javita.
Yes, Jane. We were lucky that we already trained IYCF, trained workers already, no, on IYCF. So when the pandemic came, we were already prepared. It's like a regular activity to give updates, no. But now, because even if you do online training, there's an opportunity for participants to ask questions as well. But we have not really tried the regular IYCF training. But based on our experience on training on nutrition in emergencies, we came up with 3 modalities. One is a pure online session. And in cases where there is a difficult connections, we have also a blended type of learning where we combine online as well as face-to-face training, but of course practicing social distancing, where we have regular trainers who after showing a video of the topics, there are facilitators ready to respond to questions. And then there's also exercises, but these are now tabletop exercises. So again, there are some facilitators who also assist so that they can check on the skills. So it's really just trying to come up with ways on how to make it better.
There's a saying, where there's a will, there's a way. Dr. Lin-Ma, over to you if you want to add to that.
Yeah, as already mentioned by Jovita, that we still have, in Myanmar, we still have some of the states or region at the subnational level that we haven't trained for the IYCF counseling as the counselor. So for those who will be for the first time for IYCF counselor training, we see that based on our experience, the pure virtual will not give the same result as the in-person, because even in the in-person training, we need to allot more effort for them to have the proper following of the proper steps of the counseling, how to listen to the beneficiary, how to build the trust. So we cannot check those skills to be the real counselor in the virtual mode. So we are trying to have the mixed approach for some of the sessions through virtual, but some of the sections which really need to ensure the skill, we need still in-person training, but of course following the physical distancing. Just to share our experience and impression. Thank you, Jane, over to you.
Thank you so much for answering that. There's a slightly sort of follow-on question that I don't know has a very clear answer, but they are saying that again, the problem with even online counseling is the internet connection in remote areas. And that can we really guarantee their competency in IYCF counseling from doing it remotely? And I think both Javita and Dr. Lin-Ma have answered that question in saying it's not necessarily always perfect, but you can't always let the perfect get in the way of the good. So you have to at least try it. And I think, as Dr. Rinmar has also said, as some of the countries release a level of their lockdown, some face-to-face is possible with, of course, all the practicing of mask wearing and social distancing. So I don't know if anyone wants to add anything more on this issue of how do you solve this problem of connectivity and trying to do online training in the difficult to reach places. I don't, anyone else want to add to the conversation, but I think we don't have a clear answer, but we've got some ideas that we've tried. Right, Winmar, you want to add something?
Just a point that we are not alone. We have always our partners who want to help and who always collaborate with us. For Myanmar, for most remote areas, we always have our partners, so we can make use of them. We can train them in whatever way that we can do. And then those partners, like ethnic health organizations, they can conduct in-person counseling and training in those remote areas. So this is just one way that I can think of that we are practicing in some areas. Thank you, Jane.
Great, thank you. Here's a question, and again, I'm not sure who wants to answer it, so I'll see who of you looks ready to answer it. But this person would like some view on how we can do more on creating IYCF or MIYCN friendly environment outside of the health system. And I think, Anu, in some ways, that's what you've also been trying to do, is not to have it only within the health system. So are there any lessons, Anu, I'm putting you on the spot, that you want to share with how we kind of work on this just outside of the health system, which is where we're traditionally comfortable?
Yeah.
Anu, over to you.
So I think maybe one example of what we did was, you know, we did do a sort of a virtual webinar with the China Nutrition Society, but they also then brought multiple ministries together, the Ministry of Sport and Health, the Ministry of Education, I think Agriculture, marketing regulation, and then and each of them then reached out to their technical institutes and partners, and I think we ended up with like over 2 million people, sort of, you know, where we were able to reach a large audience because there is such an increased interest in the area of diet in particular, and because of the focus on NCDs and all of that. It is an opportunity, I think, for the nutrition community to then bring it back to the core issues that are of interest to them, related back to saying, you may be interested in NCD, but actually things have to start at infant and young child feeding, you know. And that was a link that we were able to bring to that meeting by, you know, we had colleagues from New York who were able to do, just like Christina did. You know, these are new opportunities that we have. You can pre-record, you can make these things available, and then you're able to reach a very large audience just by bringing these people together.
Really helpful, Anu. Thank you so much. Javita, I've got a question for you here. And this question is whether you are seeing this as a temporary stopgap measure that you put in place while there's been lockdown, or are you looking at this being a counselling modality that's going to be here to stay? Well, I think COVID's going to be here to stay for a while anyway, but over to you, Javita.
Well, we think that it's something that will stay because the behaviors of mothers they're also working, and so even if we do have the face-to-face in the community, but the mothers are working, so they cannot be reached, and the online platform is one way to be able to reach, at least in the Philippines. Many are Facebook users, so that's one of the things that as people more and more are going online. So it's not something that we can prevent, but really have to evolve and see how we can make it better.
Javita, I'm going to also ask you just to look in the Q&A box because there's a very specific question for you, I think, from one of your country colleagues. So it would be great if you could look at that. I think also what's coming up, and there's a question here about if anyone's had any experience in using WhatsApp groups. to manage mothers groups. And I think, of course, this all depends on which are the formats of communication that are used commonly in your country. For some, we know it's WeChat, for other, it's Telegram. So I don't know if anyone wants to make any comment about if they've had any success with use of WhatsApp. It would just be one of those formats, like Christina said, you would have to test and see. And I think really important, what remained in my mind from Christina was, this is not really a time for starting new things, but rather finding those linkages, which really came clearly in both what Javita, they were using a group that existed, and Anu using existing programs, rather than trying at this time to try something new. I am coming towards the end of our meeting, and I think we've done a great job. So thank you again to all our presenters for answering in the Q&A box as we went along as well. A reminder to all our participants that if you still have questions that you would like answers to, please make sure that you let your country colleagues from either UNICEF or Alive and Thrive or the regional people know your questions, so that we can continue to see which areas you would like more information on. So don't feel if we didn't get to your questions specifically that you can't still answer them and have answers provided where we can as we journey together. So as I come to the end, and I'm going to hand over to Roger for our closing, I come again to another saying that I was thinking about when I was preparing for today's meeting, which I really thought is critical for all of us in infant and young child feeding and public health at this time. It said that adaptability is about the powerful difference between adapting to cope and adapting to win. So many of us are having to adapt to cope, but we also need to continue to have the strength and the energy that we also make sure that we not only adapting to cope, but really monitoring and measuring what we're doing, so we can be saying those adaptations are to win. So with that, Roger, your camera on and your microphone on as you give us the closing remarks.
Thank you, Jane. So thank you for the excellent presentations by the speakers today, and also put on the spot to answer so many questions, and for the active participation by everyone on the webinar. So our new reality has really accelerated ways of providing remote support, virtual support, and building online communities. It's also promising to hear that these adaptations and innovations, they might be sustained, and that we have built more resilient health systems for maternal and child nutrition on the way. So it's not something we just do now during the pandemic, but something that we can rely on for the future. And there's no doubt that digital solutions provide a great opportunity for social and behavior change. However, many of these platforms also, they provide some great threats if not regulated well. These platforms are often, free, but nothing is actually free, which means that they get their income from selling user data for targeted marketing of often commercial products, and some of them often they are directly competing with us, with public health. So social media are flooded with promotions of unhealthy foods and beverages. I think we're all seeing that. Feeding bottles, pacifiers, and breast milk substitutes. So our interventions using these platforms have very little impact unless we are also able to protect children and caregivers from the harmful impact of such marketing. So I just want to mention this at the end. It's like we're very excited here, but I hope we also have some good examples soon to share on regulation on digital food marketing. in line with WHO guidelines. And we actually have a regional resolution on this. So I think we, at a later stage, maybe should focus also on that aspect. So as I end my remarks, I would like to say thank you to Irish Aid and the Bill and Melinda Gates Foundation for the financial support to build and sustain partnerships for improved maternal and infant and young child nutrition. So also, finally, I would like to thank the organizing committee, Roland Kupka. Chris Rudert was also part of this before she moved to Kenya. Jessica Blankenship, Liz Drummond. Also, you cannot see everyone, but Belle Sutisira Komonjinda and other UNICEF colleagues. I think IT was involved here. Alison McCall from GMB and Ling Fan and other Alive and Thrive colleagues. And of course, a special thank you also to Jane for helping us with the planning and for moderating the session so well. So thank you.
So thank you, everybody. And I want to just give you all a reminder that this is the first webinar in a series of 3. So the next one will be on the 4th of November, and we will be looking at the topic of pre and in-service learning. So a very exciting topic. Put it down in your diary, same time on the 4th of November, and watch this space for the notification of it. A very big thank you to all our presenters. We know you have a big workload, especially at this time, but that you put together such fascinating presentations that really give that country sharing and learning. A huge thank you to each one of you. And then, of course, to all of you delegates. We had over 170 people on the call, and we still have over 148 that have remained for the whole 90 minutes. That's telling us just how important everybody sees this topic. So until the 4th of November, when we'll meet again, stay safe, stay well, and we look forward to seeing you then. Thank you, everybody, and goodbye.
Goodbye.
Okay, bye-bye. Bye, Roger. Bye-bye.
Bye, Cho.
Bye, Cho.
Hey. Yeah, bye.